Hello, everyone, and welcome to another episode of ACE's Arthritis at Home. Today, I'll be speaking with ACE's President, Cheryl Koehn, and we're going to review ACE's latest national survey that is being published during Arthritis Awareness Month in Canada. Cheryl, welcome.
Thank you so much, Kelly. It's really good to be back on the program.
What is the significance of launching the survey results on self-advocacy during this special month in Canada for arthritis?
I think that's such a great place to start the conversation, Kelly. I think it's self-advocacy starts right there, Kelly. It's about describing what's going on with yourself. And if we can shine a light on that in the month that is dedicated by the federal government to raise awareness around arthritis overall, and we can help inform, and as you know, I like to say, power people to use their voice, to talk about their experience, to ask for the things that they need, to join their community members and fight for new and better policy for arthritis care. I just don't think there's any better time in the calendar year to do it than this month.
We ask Canadians about their understanding of their disease, where they go to learn about treatment and care and more information about their type of arthritis, and ask them how they go about self-advocating for what they need. We also try to identify inequities or gaps in arthritis self-advocacy, who's experiencing them, what sort of challenges that they're facing, advocating for the best arthritis care that they can receive. Could you walk us through maybe some of the key takeaways from the survey? And maybe what I'll do is I'll also ask you maybe about some specific areas that I know that were really important that we tried to tease out in the survey.
Sure. So in any survey on any topic, you try to gauge what I call the public with arthritis, who we were trying to get to respond to the survey. We were trying to get a basic sense, Kelly, of what respondents' level of understanding about their own disease was. Because as I've said in my opening comment or response to your question, if what we need to do to be successful, quote unquote, successful living with disease, or be able to best manage our disease, is using our voice, the first place to start using it is to describe our disease to the people around us. So that fundamental knowledge, Kelly, about our understanding about our disease, we wanted to know from our respondents what their confidence level was, for lack of a better way of putting it, about their understanding. And, 40% of the respondents, so a sizable percentage, nearly half, said they know all they need to know, which is a fantastic result. But 41%, so roughly the same number, wanted to know more. So there's a hunger for more information. And you and I know that from the work we do every day at ACE, that we're constantly sent emails and called and texted about, well, where can I find this information? What about this? Do you know where I can go for that? So there is a real hunger. We kind of sensed that there was, and this survey confirmed that for us. But 17%, so again, a fairly sizable percentage of this cohort of respondents, said they didn't know enough about their disease, but they wanted to know more. So again, 40% said, yeah, got it all covered, know what I need. 41 said, I know a lot, but I want to know more. And 17% said, I don't know nearly enough, but I want to know more. So, half of the people that responded are hungry for more information, for more fact-based, credible, sort of unbiased information.
Underlying that is, certainly in the last 20 years, we've seen a revolution in arthritis treatment and care, and patients probably understanding that this is not sort of a fixed state, and that it's
Yeah.
constantly changing and evolving, and breakthroughs are occurring, particularly in inflammatory arthritis. But I would even say the way that we approach osteoarthritis now has changed dramatically. And certainly that's, I think, probably reflected in these findings.
Definitely. Yeah, I think you're right. I think the arthritis public, as I refer to them, and then closer to us are our members, subscribers, and followers and consumers of our programming. We can see, I don't want to say level of sophistication, but the heightened interest in what you and I might call very niche subjects, Kelly, like really getting at the nitty gritty, has certainly risen over the years. But still, as this survey alludes, there's still a very basic craving for basic information: what it is, how you get it, how is it going to progress, how is it treated, what does my future look like? So really basic information about arthritis is still very much needed by the arthritis public.
So to go back to your definition of self-advocacy at the start, as a way of reaching out to others, explaining your arthritis experience, and ultimately learning how to ask for support and help. ACE focused on that area, asking people their top sources of emotional support. And what we found is that respondents in both the English and French speaking populations identified close friend, spouse, partner, and family as the top 3 sources of emotional support. We find some striking differences with other patient populations.
Yeah, definitely. I thought this was some of the more interesting findings of the survey, and I'm glad you asked this question. So, as you know, we're really trying to, with all 4 of our surveys, this being the 3rd that we've run in this calendar year and are reporting out on, the BIPOC community is experiencing arthritis in every sense of the word. So our Black, Indigenous, and other people of color, people who have our LGBTQ community, are responding differently to our surveys across the surveys, Kelly, and this holds true for this survey on self-advocacy. So people from the BIPOC community were, they were 3 times more likely to get emotional support from online communities. That's striking, given the non-BIPOC community has said they're doing that within their own very close network of friends and family. Again, another interesting finding, as the BIPOC community who responded to the survey were 2 times less likely to get emotional support from their rheumatologist. And I mean, I find that super alarming, because the rheumatologist, well, granted, they're really there to deal with the medical side of things. Because they are specialists in the disease, they're very trusted by patients. And you would hope that for all patients, whether they're from the BIPOC community or not, that trust crosses over to the seeking of emotional support. Now, medical professionals have a bandwidth, right? They have their area of expertise. And that's not to suggest that rheumatologists can be, must be, or should be expert in all of these other realms. But they should at least create an environment for all patients to welcome requests or seeking out of information from their patients about emotional support, so that they can be best directed to credible sources. So my concern about seeking emotional support from online communities is, in the last 3 or 4 years, we have seen the ugly rise of mis or disinformation online. And this isn't just in our politics, Kelly, or about COVID. It's about everything. So I'm concerned that people get fact-based emotional support online for those who are primarily seeking it in that way. The BIPOC community was 9 times more likely, and these are statistically significant findings, Kelly, more likely to get emotional support from a community advisor, which is really interesting and very different again from the non-BIPOC community.
One of the key priorities the ACE audience knows that we have as an organization is sharing information and education and advocacy work around work and arthritis. Arthritis is the leading cause of disability in Canada. It's a well-worn fact, but what does that really mean for our patients across the country? And we tried to dive into that in the survey, asking them about their experience at work. And it's important, I think, to remember that when we talk about a leading cause of disability at work, it's not just work absenteeism, it's work presenteeism, that the challenges people have at work living with arthritis. What were some of the key findings in that critical area?
Yeah, I should say to start to answer this question, Kelly, I should say that the survey respondents, just below half were living with a type of inflammatory arthritis. And that is the type that drives work disability in the country. So we had a high number of respondents in that, and as well, we had a high number of respondents who were self-disclosed were living with a physician-diagnosed form of lupus, and then the balance were with osteoarthritis. So I give you that data as context setting for these findings around work and arthritis. The majority of respondents, Kelly, told their friends or colleagues, so their coworkers, about their arthritis diagnosis within a few weeks or months after receiving it. That finding surprised me in some ways. But when I reflect back on my own diagnosis 31 years ago, and I was a working person at the age of 26 or 7, there go, I've given away my age if people can want to do the math. And I couldn't hide my diagnosis, Kelly. I was barely able to walk, and my knees were the size of soccer balls because of the inflammation. My hands, all of the definition on the back of my knuckles was gone because my hands looked like Michelin Man hands. I had so much edema that it was visible to my colleagues. And a few of them asked me, so it's I couldn't hide it. And I worked for a very small firm. I had really well-established relationships and a level of trust in my employer and my colleagues that I disclosed. So I think that that finding that a large number of our respondents disclosed within such a short period of time, this is my hypothesis, Kelly, behind the finding, is that it's because a large number of our respondents had inflammatory arthritis, and likely couldn't keep it, secret. We didn't ask about their employer size. So there are things we can do to look into these other data to try to do some fine tuning. When we asked them if they know how to deal with those limitations at work caused by the majority said yes. So many of them said, yes, we can kind of figure it out. Followed by about a quarter of the respondents who said they weren't sure at all. So nearly half said, yeah, they could figure it out, but a quarter said no. But here's a big sort of aha moment for us. The BIPOC community revealed a statistical significance related to asking for and receiving job accommodations from an employer. So they were 2 times more likely to ask for job accommodations if they were from the BIPOC community. So that can be good and it can be bad. There can be a stigma attached for asking more frequently than a non-BIPOC community, or there is, that's positive action. That's self-advocacy in action. They're keenly trying to stay in the workforce by asking for accommodations, but we don't know which it is. I suspect a little of both will happen. 7 in 10 of our BIPOC respondents, so almost 70%, said they did not ask for job accommodations. So therein lies my first sort of assumption, is that a large number didn't because they were afraid of being stigmatized, and more so than a non-BIPOC population. A lot of work to be done there in terms of workplace education.
Absolutely. And I should remind our audience too, it's not just ACE that does a lot of work in this area. Other patient groups in Canada,
Yep.
Like CAPA, like the Canadian Spondylitis Association, and Arthritis Research Canada are all doing really important work in this area and are good sources of information as well.
Yeah, in fact, the scientific director of Arthritis Research Canada, Dr. Deanne Lacaille, has spent much of her research life looking at not just rheumatoid arthritis in the workplace and the impacts it has on people like myself, but also in osteoarthritis, and has developed workplace programming. And we'll provide that resource, Kelly, at the end of this session.
When people go to our website to look for more information about the survey questions and responses, they'll see asked a question on what type of challenges people have living with arthritis, and we gave them a long list of things that they could choose from. Once again, though, in terms of the findings, we saw an interesting disparity between patient populations again.
Yes. Yeah, so I want to say this before I share these 3 data points. It's not that ACE doesn't care about the non-BIPOC community. It's that we care a lot about ensuring that the BIPOC community is on par in terms of the things that are being offered to them in the way that they want them to be offered as our non-BIPOC community. In terms of the differences and the challenges of living daily with arthritis, Kelly, we found a statistical significance in the experiences of BIPOC, of the BIPOC respondents in our survey. They were much more likely to experience challenges in advancing their career. So 3 in 10, or a third, versus only 17% in the non-BIPOC community. And this is true in arthritis in general, Kelly. So in general, people with arthritis have a hard time advancing in their careers for multifactorial reasons. But people who are in the BIPOC community have a much more difficult time of it. They're 6 times more likely to experiencing challenges with staying in school, which I touched on before. So 12% in the BIPOC community versus 2%. So very low challenge rating in the non-BIPOC community, but statistically significant in the BIPOC community. So those were really interesting, I think, findings. As you know, our question set was kept at a very high level, Kelly. So there is a lot of work to be done on these findings. We need to go back and work with our partners in social and medical research to find out more about these differences.
Finally, Cheryl, one other area of questioning was around where patients were getting their information about their disease and what some of the top sources were. Can you just elaborate a little bit on that area?
You bet. So obviously there's a vested interest for arthritis consumer experts to ask this question, because we are a nonprofit organization in arthritis, the largest in the country, serving patients with a membership of over 50,000 people. So this, of course, is of great interest to us. We want to find out in some ways how well we're doing. Are people using our services how can we do better to meet their informational needs. And what we found out, Kelly, and as you know, we gave them a long list, and these are the top ranked items that they selected when we asked them. So websites could include patient organizations. We asked generically, where they were going, and websites was number one, 8 in 10 or 85% of our respondents. And then members of their healthcare team, which makes us very happy, of course. It means people are self-advocating. And remember, asking questions of health professionals is a form of self-advocacy. You're actively seeking information to inform yourself, in which case you will make decisions, your health literacy will rise up, and you're more likely then to be active in your own care, but you may also be active in using your voice out in community. So that made us very happy. And it also made us happy, not happy enough, that patient organizations, 3 out of 10 of our respondents sought information from organizations like ours or others in arthritis, 30% of our respondents. And that's actually gone up over the years, Kelly. Part of that increase, I think, is because we work every day, as you know, to gain the trust of the medical professionals we work with, namely rheumatologists, physiotherapists, occupational therapists, rheumatology nursing. We work really hard every day to earn their trust, to ensure that they know we are giving correct, easy to read information on the different types of arthritis. So it's gone up, but it's not high enough. I mean, we would, of course, like that to be very high. Why? Because not only are people out in the public getting good, credible information from ACE and others, they're also tapping into community, Kelly, and they're getting a chance to tap into support, collegiality at the patient consumer level, and learning about opportunities to exercise their voice through self-advocacy campaigns. So that's another reason we want to see that number go up, because it's not just information we're providing. We are a mirror for them. They can see themselves in our organizations, and that means a lot to improving one's health outcomes. We know that through research. And then other people living with their type of arthritis, so they are doing community bonding through organizations like ours. And then lastly, printed pamphlets or guides. So there's still people out there who want a printed piece of information. A quarter of our respondents said, give me a pamphlet. And as you know, we're still providing those for some of the pieces of information that we have online.
Yeah, I think just to follow on your comments, a key message for us to arthritis clinicians, the rheumatologists, but also all the arthritis health professionals is please refer your patients to our resources. And again, not just ours, there's other organizations in Canada who have excellent information, but there does seem to be a bit of a breakdown there that if they are going at a high number to look for information from their healthcare team, we really hope that healthcare team also lets them know about our resources as well.
Yeah, absolutely. I'll just leave it at that. Please refer to credible fact-based information sources and aids. But I want to end this conversation, Kelly, on something that's really important for all of those groups you just mentioned. So our peer groups, rheumatology associations, and individual rheumatologists. The finding around information seeking in the BIPOC community was disturbing for us, as you know. They reported that their ability to understand arthritis information, so in the way that we are providing it. So this isn't a problem on their end, it's a problem on our end. In the BIPOC community, they were less likely to find written information about their type of arthritis easy to read and understand. More than half, Kelly, responded that way, 56%, versus the non-BIPOC community, okay? So there, yes, we're doing a good job for some in the BIPOC community, but a large number are saying that they find materials out there being given by a variety of providers, information providers, not easy to understand, read or understand. So I think that's kind of a call to action. Clearly, it's one of the reasons we are running this survey program, and we'll continue to run it into 2022, is to continue to find ways to improve our service, our understanding, our ability to outreach to, and provide information to the BIPOC community. We just have to do better. And I will underscore for our Indigenous brothers and sisters in this land.
Thanks for those insights, Cheryl, on the national survey that ACE conducted on arthritis self-advocacy. If people want to get more information, we've just published a joint health insight that dives deep into survey findings. We also have an infographic that people can look at as well. So that's all on our website. We look forward to people's comments too. If there's some things there that you're interested in following up on or have some comments, we're looking always for your feedback. So thanks again, everyone, for joining us on another episode of Arthritis at Home. Cheryl, thanks for taking the time to walk us through the survey findings.
Thank you, Kelly. Bye, everyone.